The distal humerus is the lower end of the humerus. It forms the upper part of the elbow and is the spool around which the forearm bends and straightens. Now the question arises, what are the important features to remember over here? I know these will haunt you before your anatomy exam. So do not worry and stick with me. Let's discuss each of these in detail. The radial head is the knobby end of the radius where it meets the elbow. Keep in mind that the distal end of the humerus includes two smooth articular surfaces known as capitulum and trochlea. The capitulum is a convex and rounded projection that covers the anterior and inferior surfaces of the lateral condyle of the humerus. Unlike the trochlea, it doesn't cover the posterior surface. It articulates with the head of the radius. The trochlea has a surface shaped like a pulley and covers the anterior, posterior, and inferior surfaces of the medial condyle of the humerus. It articulates with the ulna at the trochlear notch. When the elbow is in the extended position, the posterior and the inferior aspects of the trochlea are in contact with the ulna. However, when the elbow is flexed, the posterior part is no longer in contact as the trochlear notch slides towards the anterior aspect of the humerus. A mnemonic to remember this fact at the elbow joint is the crazy tulips. The C stands for the capitulum articulating with the radius, whereas the T stands for the trochlea, which is articulating with the ulna. Now there are two fossas or grooves that are present superiorly to the trochlea. On the posterior end, you can observe a deep hollowed area known as the olecranon fossa. During the elbow extension, the tip of the ulnar olecranon process lodges into the olecranon fossa. On the anterior surface, another hollow is located, which is smaller in size, the coronoid fossa. During flexion of the elbow, the coronoid process of the ulna lodges into the coronoid fossa. A third fossa is also present. This is the radial fossa. It is present lateral to the coronoid fossa and superior to the capitulum. It is so named as the margin of the head of the radius lodges there in full flexion. Now talking about the projections, on the distal end, there are the epicondyles. They provide attachments for the muscles concerned with the movements of the forearms and fingers. We can observe two. One is the lateral epicondyle and the other is the medial epicondyle. The medial epicondyle is a blunt projection superior-medial to the medial condyle, which forms at the end of the medial border of the humerus. The ulnar nerve crosses its smooth posterior surface and is palpable in this location. From the anterior surface, the superficial muscles of the anterior compartment of the forearm originate. The lateral border of the humerus ends at the lateral epicondyle. There is an impression at the lateral and the anterior surfaces where the 7 muscles of the superficial group of the posterior compartment of the forearm originate. As we move a bit proximally, we can appreciate raised edges are continuous with the borders identified as lateral supracondylar crest and medial supracondylar crest. I mentioned muscle attachments at each portion of the humerus as these are particularly important. We'll now discuss the origins and insertions of these muscles into the next section.